Hello friends, for UG and PG students, practical viva exam is very important. So that's why today we'll discuss one important topic, that is general survey. In physical examination, there are three parts. One, general survey. Two, local examination. Three, systemic examination. Most of the students call general survey as general examination. That is the wrong term. So what is general survey? This is quick overview of patient from head to toe. So it has one parameter like mental state or GCS score. Mental state at 5 stages. So if the patient is not fully conscious oriented, you can stage it. Then second parameter is performance status. It has Karnofsky scale or ECOG scale. ECOG scale we mainly use when the patient is having any malignant disorder, cancer. In Karnofsky scale we use in benign diseases. So this is the chart of Karnofsky status and ECOG grade. So you can mug it up. Number third is decubitus. In decubitus is attitude of patient in bed. Patient may lie still. In peritonitis. In pancreatitis, patient may be bending forward. In renal colic, patient may be restless. So this is the peripheral arterial disease. Patient is holding his right feet to decrease his rest pain. Next parameter is BIL, that is measured by BMI and nutrition. BMI is weight by height square. If it is less than 18.5, that is underweight. If it is more in between 18.5 to 25, that is normal. If it is more than 25, that is obese. This is mid upper arm circumference. If it is more than 23 in males, that is normal. If it is more than 22 in females, it is normal. Next parameter is hydration status. Patient tongue may look dry, skin turgor may get lost, and urine output may be decreased. Okay, so patient may look thirsty also. So you can see in this picture, patient skin turgor is already lost, skin elasticity is already lost. Number 6 parameter is faces, the appearance of face of the patient. In thyrotoxic space, patient may look exophthalmic, visible upper sclera. In myxedema spaces, patient is having puffy space, periorbital edema, thin eyebrows and dry hair. In moon faces, patient is having rounded face, also hirsutism and facial acne. Number 7 parameter is gait. It's seen in muscle, neurological and psychiatric disease. There might be waddling gait which occurs in bilateral congenital dislocation of hip, or Trendelenburg gait you can see in Perthes disease and poliomyelitis. Number 8 parameter is pallor. To look for anemia, you should check pallor in lower palpebral conjunctiva and other body parts. So you can see this is the lower palpebral conjunctiva and patient is having pallor. Parameter is icterus. To look for jaundice, you should check icterus in upper bulbar sclera and other body parts. So clinical jaundice happens when the bilirubin is more than 2 mg/cent. You can see upper bulbar sclera is checked. Number 10, cyanosis, bluish or purplish discoloration of skin or mucous membrane due to reduced hemoglobin more than 5 gram per deciliter. Peripheral cyanosis due to oxygen desaturation in venocapillary area seen in cold. Central cyanosis seen in shunt abnormality of heart or in lungs due to oxygen desaturation in arterial blood. So this is peripheral cyanosis. Clubbing, that is increased transverse and longitudinal curvature of the nail with increase of angle between skin fold of the nail and the nail bed. So increase in lobibund angle. So if it is more than 180, then you can call it club finger. So these changes are due to proliferation of subungual connective tissues and also diffuse enlargement of terminal phalanges. Also look for fluctuation at the base of nail. Then look for Shamrock sign, where diamond shaped gap disappears, which normally present when two normal fingers are opposed. Then cause of clubbing and grading of clubbing is given in this picture. You can see it. Then look for edema, which is excessive accumulation of fluid in extravascular space. It can be local edema, which is due to venous or lymphatic obstruction, also seen in DVT or filariasis. In generalized edema, it can be due to congestive heart failure or nephrotic syndrome or cirrhosis. So this is the site where we check. This is pressing on the medial surface of tibia 1 inch above the medial malleolus in ambulatory patient. In non-ambulatory patient, we check at the sacrum. Okay. Next is jugular venous pressure, where we look the upper level of pulsation of internal jugular vein from the side of the patient from the level of sternal angle in centimeter vertically. Patient head should be in 45-degree propped up condition. If it is more than 3 to 4 centimeter, it is considered as abnormal. So this is how we check the jugular venous pressure. So there are 3 waves like ASC V, which are positive waves, and 2 negative waves, which is X and Y. It is seen in congestive heart failure and superior mediastinal syndrome. Next is lymph node. examination, that is very important. Virchow's lymph node we can see in GI cancer, and jugular lymph node can be present in oral cancer or thyroid cancer. You can see I am checking the level 1A and 1B lymph nodes, which is submental and submandibular lymph node. You can check it from front or behind. Okay, so neck should be flexed and little bit turned to your side to relax the deep cervical fascia, and you can check the upper jugular, middle jugular and lower jugular lymph node, which are 2, 3 and 4. Level 5 lymph node we check by asking the patient to shrug his shoulder and we palpate it. Level 6 lymph nodes we palpate at pre and paralaryngeal and paratracheal region. Then we check for pulse, where rate, whether it is tachycardia or bradycardia, then rhythm, whether regular or irregular, then volume, whether it is normovolumic, hypo or hypervolumic, then tension, where the pressure required to obliterate the pulse wave. Okay, so you can see I am palpating the radial pulse here. And also we check condition of vessel wall. In old age, in atherosclerosis, it gives wire-like feeling. Then blood pressure, we measure it by sphygmomanometer, whether it's hyper or hypotension, we auscultate it. Then in respiration, we check the rate and the pattern, whether the pattern is thoracic abdominal or abdominothoracic. In temperature, we check whether the patient is febrile or afebrile. If the patient is febrile, if it is continuous type, then fluctuation will be less than 1.5 Fahrenheit. In remitted fever, the fluctuation will be more than 2.5 Fahrenheit, but it doesn't touch to baseline. In intermittent, temperature comes to normal. We should also check for pigmentation of face, oral cavity, palms and soles, because it can be seen in Cushing syndrome, Port-Jagger syndrome and Addison disease. Thank you. These are the parameters we see in general survey. So students, today I have discussed the first part of physical examination, that is general survey. In my next video, I will discuss about local examination and also systemic examination. So in local examination, I have to discuss about hernia, varicose vein, peripheral arterial disease, parotid or thyroid swelling or even breast swelling and abdominal mass. I will discuss these things one by one. So for doing general survey, one need only 5 to 7 minutes. Here in this video I have explained to you, but in exam you don't have to explain while taking or doing general survey. So you can do it easily if you know. So for this kind of videos, you subscribe my YouTube channel and you can also share to your colleagues so they also get benefited. Thank you. Take care.